So what are actually challenging behaviors? They are the repeated patterns of behavior that interfere with either learning or engagement with the peers and adults. So this can cause issues with the social interaction, mixing with the kids of the child's age, and so many things. And these behaviors can be harmful to child himself or to others. And this can make a child to isolate from others, because if the child is hitting, biting, then the other children's parents won't allow that child to participate in the interaction, which is play interaction. And so as a result of this, these behaviors are called as challenging behaviors. Which are the commonest challenging behaviors? There is a big list, but to enumerate few, the hitting, beating, biting, then tantrums is the commonest thing, then damaging objects, throwing objects, along with that scratching others, self-injurious behaviors, stimming behaviors, then hand flapping, finger fidgeting, food refusal, and so many risky behaviors. So when we go ahead with this list, we are trying to cover some of the commonest scenarios which are faced by parents while handling their children with the autism. So, sir, which are the commonest things that come to your mind when it is the word challenging behaviors in children with autism?
What is a behavior? Here is a response of a child to a thing around which is happening. And when it comes to children with autism spectrum disorder, this response is very much unpredictable. And this unpredictable response may be a shock for the child himself as well as for the mother, father who are managing the child. Now let's see in which way these behaviors come. So let's understand the basis of that. As you're all aware, there are two limbs of autism spectrum. One limb is a problem with the social communication, and other limb is a repetitive restrictive behaviors. Now, a child who wants to communicate a very simple thing, that mom, I'm hungry, I need food. Very simple need. But because the child cannot communicate, now the problem is there is a lack of that communication. Because the child cannot communicate, he or she gets frustrated, and that frustration converts into an abnormal or a challenging behavior. Another thing, child is irritable or child is in his own, what is autism, autos is self. Child is involved in himself and is enjoying himself. For example, a child is just repeatedly moving around, a child who is spinning, a child who is sometimes hand flapping, and sometimes the child may be doing head banging. For a parent, and not only for the parent, for the society also, this particular spinning or this moving around which the child is really enjoying is taken as an abnormal behavior. So this is another way to look at the behaviors in children with autism. Second thing, and the most common thing apart from these two limbs, is any child. For children with autism it is a bit more, are the tantrums. The child doesn't like what is happening around, and then the child blows up like a volcano, and that is a tantrum. And the fourth way to look at the same problem is the children with autism spectrum disorder, they are having a sensory issues. They cannot manage the senses which are coming to them. Sometimes there is a sensory overload, or sometimes there is sensory insensitivity. And because of this overload, the child gets disturbed, and that is called as a meltdown, and which also is like a big tamasha. The child is crying a lot and with no reason, is unable to settle, and that all becomes a challenging behavior.
Here the first scenario that I am just going to narrate. One of the parents, they told us that their child doesn't follow instruction. That is, whatever the way the parents try to give the instruction, child just refuses to follow. In such a case, for a child with autism, sir, how should the parents go ahead?
Absolutely. Now, ये तो common problem. In Hindi, they always parents say, मेरा तो सुनता ही नहीं, मेरा बच्चा सुनता ही नहीं, and a time comes, mother is saying again and again to the child is not listening to the mother, and everything goes wrong. Now let's discuss this in the view or in the background of that lack of social communication. What is happening? The child is again involved in himself. Classically, especially the moderate to severe level, the child is having poor response to name, and especially to the adults who are not in the common whole day-to-day activity. So keeping mother and father aside, let's take the teacher. So the child is just not listening to her, and then the teacher complained that this child is not listening to me. This is a problem behavior. Another way to look at it is attention in it. The child is in looking at something else. So there's a poor attention, inability to follow instructions. The child is unable to understand what type of instruction. Simple instruction. Please come over here. At present moment, the child is just not listening to that, and that is one of the way to call it. It is called as a theory of mind. The child in his mind is not motivated to listen to you, and then it is taken as a problem, and the child is disinterested in what you are doing. All this comes to the reason of the child is not following instruction. Why I am discussing all this reason? Because the first step to manage a child, abnormal child here, is look at the reason behind it. So if you are unable to understand that he is not able to listen because he is involved in somewhere, he is not having attention to you, and that is where the problem of doesn't following instruction comes. Now what to do for that? There are 2-3 ways to work upon this. When you are aware that my child, this child with autism, is having lack of that eye contact and lack of that response to the name or response to the instruction, what they are strong at, you'll be surprised. They're not strong at hearing, that they may be very good at vision, but they're much better with the touch. So few of the people who are here with me over the last few months, they must have remembered my saying a very important sentence. If you want your child to get connected with you, the strength of the child is in touch. Why don't you connect with the child by touch? So if you have to avoid this problem, my child doesn't listen to me, first thing is my child should touch me very quickly. So we need to touch, look at the child, get eye contact, and then talk to the child. And that is what is the problem or the solution to the problem, that my child is not listening to me और मेरा बच्चा सुनता ही नहीं, तो दूर से चिल्लाओगे कुछ होने वाला नहीं. उसके नजदीक जाइए, उसको स्पर्श करें, उसके हाथ, keep a hand on his shoulder, keep a hand on his back, give him a comforting touch, and then look at the child, and then tell the child, let's go to the food, let's have a drink, whatever you want to say. So touch, connect, that is the first thing. Another thing is there is a time lag for these kids. So when you tell, come here, it may happen that the child is involved in something else, and the child is not listening to what you are saying. So what is the important part? What the child is doing, let him complete. As you are all aware, children with autism have a very short attention span. So they don't continue on the same game for a long time. And if the child is playing something, just give him time to complete it and then ask him. And there is a high chance that the child will listen to you. So it is, unfortunately, the child is not doing it purposefully. Very few children with autism do purposefully neglecting their parent. It is common seen in a typical adolescent children. Those who are in their puberty, they're having those antenna up, and they just don't want to get connected with the parents, and that is where we need to be working on it.
To summarize, sir, in this you are suggesting for parents that when they want to their children to follow the instructions, they have to go near to the child, touch the child, and then give the command. And a big request, or if the child doesn't respond to you, don't shout at him. Go near to the child, again talk to the child in a positive way, and then only you can get the child on the same platform where you are.